Joining us right now is Dr. Scott Gottlieb. He is the former FDA commissioner who sits on the boards of both Pfizer and Illumina. He's a CNBC contributor, and he's been with us almost every morning from the last year. Scott, as we always do, want to turn to you just to get reaction on this. I have to say, I'm pretty excited about it because Albert Bourla says that they're going to be filing in the next few weeks with the FDA to extend that coverage all the way down to 12-year-olds. That would be much sooner than I would have anticipated. How long would something like this take to work its way through the FDA?
Well, we'd probably have it in time for the fall school year, which is I think, what people have focused on. This will probably take about a month. The last applications took about a month for the FDA to review. I would expect this data to take the same amount of time. That FDA is going to go through it very carefully. I would expect that they'd probably bring it before a public advisory committee, and ACIP will want to review the data as well. So I think they're going to go through the same careful process that they've gone through with the other data sets for the adult population. But that still puts you in a position of having this available. Hopefully, if everything goes well and the FDA review holds up, puts you in a position of having it available for the fall. The other thing I would just point out, there's data coming out of Israel right now. There's all kinds of data coming out of Israel, real-world evidence about the vaccine's efficacy in that population. But one of the studies that came out just recently was a study looking at the incidence of infection among 16 and under once you got the adults vaccinated. And what they showed was that the infection rates in kids dropped dramatically and basically in line with the infection rate in adults. As the infection rate in adults declined, so did the infection rate in kids. So the best way to protect children is to get adults vaccinated.
And that kind of brings you to the question of state by state. We have different states that have said, OK, anybody can get the vaccine at this point. And then you have other states like New Jersey that only as of April 5th, they announced this morning, as of April 5th, you can get it if you're 55 and up, age 55 and up. They have been much tighter in controls of who they allow. When you've got states like New York right next door saying anybody can get it as of April 6th, then probably at least more than a dozen states that have said already anybody who qualifies age 16 and up can get it.
Yeah, look, I think over the month of April, and we've talked about this, that eligibility would open up towards the end of March, early April. I think by the end of April, certainly, and as we get into April, you're going to see eligibility open up pretty consistently across the states. I mean, this is basically what we've had all along, which is 50 policies on vaccination in this country because we didn't have a federal direction on who should get vaccinated when. So we've left it up to the governors, and you've seen different regimes in different states. And at times, it's felt unfair because people who are similarly situated to you in other states had access to a vaccine and you didn't, depending on what state you're in. So, it's not an optimal system to have this kind of heterogeneity.
Are some states doing a better job of rolling it out, and that's why they're able to open it up to everybody? Or are some just states saying, just forget it, we're not going to prioritize, you guys figure it out yourselves, just the same number of vaccines and appointments, and it's a survival of the fittest? What's the right way to go about doing this? Because I have to say there is frustration for people who feel like, wait a second, if I live 12 miles that way, I could get it already?
I think it's a combination of factors. In some states, you're seeing better demand among the older population, so it's taking them longer to work through it. Some states are doing a better job distributing their available supplies, so they're pulling down what's available to them. Some states are willing to make a broader population eligible to be vaccinated and tolerate the fact that the first 2 or 3 weeks of that are going to be messy. Once a state opens up eligibility wide open, a lot of people are going to complain that they're going onto the website and can't get an appointment. And it's going to take a couple of weeks to work that excess demand, that initial surge of demand off. I think some governors are more willing to embrace that than others. So it's really a combination of factors that you have pretty divergent policies across the country. But that said, I think this is all going to converge at some point this month. I think by the end of the month, certainly, you're going to see pretty uniform eligibility across the country.
Shepard Smith here. Thanks for watching CNBC on YouTube.